So they looked at monoclonal antibodies for SARS-CoV-1. They've looked at it for the MERS, which was a sort of a similar type of outbreak that was really scary, but never really went anywhere, thank God. But yeah. So they've looked at this for other viruses as well. Uh, the challenges around monoclonal antibodies are several fold. One, they cost a lot to make. They're much more expensive to make than things like vaccines. The capacity to manufacture them is lower. It's a little bit more of a complex, generally a more of a complex manufacturing than it is for a vaccine. The dose is much higher. So a vaccine may be a few micrograms in order to induce an immune reaction, and that immune reaction is self-replicating. Basically, you prime the immune system, and the immune system goes to work. The monoclonal antibodies, the dose that you administer initially is the highest that dose is ever going to go, and then it's going to wane over time. So those doses for monoclonal antibodies tend to be in the milligrams range per kilogram. So you may need 10 milligrams per kilogram in a 200 kilogram person, which isn't, or I'm sorry, in a 100 kilogram person, that would be a full gram of antibody. Where so you're looking at a gram versus a few micrograms for a vaccine. So much more required for monoclonal antibodies. And as I mentioned, the duration of protection is less. When you infuse that antibody, that's the highest level you're going to get, and it starts to wane over time. And generally, 6 weeks to a month, later, it's pretty much past its half-life. Now, there are some technologies to increase the half-life, but those also come with some tricky manufacturing additions as well. So I sort of look at at antibodies as being a bandage, and the vaccine is really the stitches. The antibodies can hold us over until vaccines are ready and can be used in certain situations, but I don't think they're not really applicable for the general public. There's just not the capacity to manufacture them, and they cost way too much to use across the entire population.
So we're not just looking at a clinical research issue, we're looking at a supply logistics issue as well with MABs.
Absolutely, yeah. I mean, the MABs themselves, as I said, they're expensive to make. There's limited capacity to make them. Some of the really successful products that are out there, like Humira and such, we can't stop making Humira and turn those plants into making an anti-COVID monoclonal antibody, because people need those other antibodies for their treatments. Those treatments can't stop. So you have to try to add on top of the existing capacity, and the manufacturing process itself. It's sort of a two-edged sword. It's a common platform pretty much for all MABs. It's very similar the way there's some variation, but it's very similar the way you purify them and such. But it also requires common raw materials. So now if you have a lot of monoclonal antibodies that are being developed for COVID, and they're all competing for the same raw materials that are needed for making things like Humira and other monoclonal antibodies, some of the really effective anti-cancer drugs. So now you're competing for raw materials as well. So it's across the entire supply chain, from raw materials all the way to the final vialing, the fill finish, that's going to compete with existing products.